Dr. Dan, could I ask you a question, please? The overhead for private health care insurance companies is 30% from what I've read. And then the overhead for Medicare, I believe, is like 3%. That is a huge difference. That's 10 times more overhead cost in private insurance companies than in Medicare. How do you feel about a single-payer health system or a single-payer system being included in the plan Barack Obama's presenting?
The question is about the single-payer system. And I did spend 4 years in Canada in that single-payer system, and it has its own set of problems as well. One of the reasons, and they spend about half as much as we do in this country, but there's a thing called rationing of health care, meaning you just don't give it. I never saw a patient in the clinic that I scheduled for a tonsillectomy in the operating room. There was a 3-year waiting list for a tonsillectomy. And there was, months and months waiting list for a lot of different things. And so it's got its own set of problems as well. But regardless of who pays for this system, regardless if it's one person, 2 people, cash, or whatever, it costs too much. The system that we're paying for is broken. 10% of all the tests we do are simply because we can't find the test. So we repeat them. And either you pay for it or your insurance company pays for it, but in the end, we all pay for that. And there's so many errors that happen. There's just, I can go on and on. I don't want to bore you, but we have to fix the system. And then we can figure out how to pay for it. But if we can reduce the cost, if we can significantly, and we can significantly reduce the cost of healthcare, we know how to do it. And we can make that model here in Kentucky. And in so doing, we've developed so many jobs here as well. These things are so tied together. Healthcare and the economy and education are all so tied together. If we do that, then we drive in high-paying jobs. We create an economy. And that means we've got more money for education. All these things are tied together. And there's going to be a lot of politicians that will stand up here and tell you that they want to fix healthcare. And they want to bring you jobs. And they want to fix education. But you know what? They also are going to tell you they're going to give you a chicken in every pot, because we've heard that before. We've heard all these promises, but very few of them are going to come up here and give you the way we're going to get there. They're not going to give you the roadmap of how we're going to get there. I know how we're going to get there. We're going to get through fixing one of our most difficult domestic problems we face today, and that's health care. And we've been working on this for 10 years because we have some experience. And that's one of the reasons why I'm still practicing medicine. One is because I'm the only ENT physician for a large part of eastern Kentucky, and I can't leave my patients. And the other is because that feedback of what's happening is critical for changing the system. Critical for changing the system. So the system has to be changed, and then we can all afford it.